So good morning, everybody. Thank you very much. Oh, that's not me. That is me. Good morning. Thanks, Will, for the invitation. Thank you, Margaret and Layla, for getting us off on that note. And I think that's exactly the right way to start today. As Will says, I'm going to talk to you briefly about the role of digital and wearables in the 10-year health plan, and a little bit about the drivers for why this agenda's come up, a little bit about how this fits into the plan, and some of the early thinking that we're doing on wearables. But this community is a vital community and partner in that delivery. It is a significant shift that's available here. I'll touch on those three shifts, but the ability to actually integrate into the way that people live their lives and be able to do our prevention, our care delivery, and our research in a way that fits around people rather than asking them to fit around us. So I'll be brief on the drivers, as many of you will know them, either if you're studying or working in the NHS or know somebody who is. You'll know that finances remain very tight. Despite significant increases, NHS expenditure is taking up a bigger and bigger portion of public expenditure. It's a top government priority to work out how we can deliver and improve care, but in a way that's affordable. We've increased the number of staff in the NHS significantly over time, but that alone isn't the answer to meeting rising demand and constraints around supply. We know we've got to work differently. And all of that is showing up, unfortunately, in public satisfaction data, which is far lower than it has been historically. We also know, and it's been touched on, that there's significant differences in people's experiences of care and in their outcomes, not just in length of life, but in quality of life and healthy life expectancy. So all of this is pushing government to think we can't carry on delivering care and achieving health in the way that we've done before. We've got to find a new way of doing things. The answer that the government's bringing forward is the 10-year health plan, and a closely related document, the Life Sciences Sector Plan, which I also work on. Now, this is very explicit on the role of 5 big bets technologies. That includes data, a very broad category, artificial intelligence, genomics, robotics, and wearables. And there are some very specific commitments around wearables. So by 2035, the commitment is that wearables will be part of standard care in preventative, chronic, and post-acute care. And there are some nearer-term goals as well, such as in cardiovascular care, achieving that for remote monitoring by 2028, only 2 to 3 years from now. These are ambitious goals. There's also a commitment to transform the interface with patients and the public through moving the NHS app from being an important and valuable administrative tool to something that actually starts being a companion in supporting people's health, and integrating the data from things like wearables, digital therapeutic apps, other technologies into that, all underpinned by a secure single patient personal health record. And as Will touched on, the main sort of philosophy or strategy within the plan is these 3 shifts. And I think we've heard already in the talks this morning examples of how these technologies can contribute to achieving them. So from a patient perspective, moving from a sickness-orientated service to a prevention service might mean, like Margaret was saying, that you're getting earlier insight into what might be coming rather than waiting for symptoms to occur before you present. That's some of the promises of these technologies. Shifting from hospital to community. So the fact that these technologies, as in Will's picture, it looks very much like my journey on the London Underground here this morning. These things are deeply embedded into people's lives, and they are in the places that they work, live, travel, grow, learn. There's an opportunity to actually be bringing care into places where people are, whether that's through remote monitoring, through care at home, and in the new neighbourhood health settings that are being developed, and all the ambition being at lower burden to patients. And again, the inequalities lens on that, we know that time taken out of work, time to travel to appointments, time to come and participate in healthcare and research, that there are major different ability to participate in that kind of activity. And finally, the analog to digital shift. I mean, that's fundamentally what this is. But again, from a patient perspective, we are wanting to move from having to rely on memory, from having to rely on scribbled notes, from having to rely on that one moment, that episodic moment where you're with a care professional, where there's a pressurized time, to having that information constant, developed, curated, and enabling really good interactions between professionals and patients. Now, people in this room will know far more about the development of this technology, and we'll hear more about that later today. But we are also very conscious that the rate of development of technology is opening up significant possibilities. And there are many challenges within that, but we are moving from being able to measure steps, albeit not yet necessarily consistently or in the ways that we can place full reliance on, to a number of devices that are measuring everything from sleep quality and moving up into what we would actually regard as medical grade devices, which means they'll become regulated devices that we need to think differently about in terms of how we integrate them into the health and care system and monitor them. So how do we actually turn all of that exciting technological development into value? And value from, when I talk about value here, we're thinking about the end of this chain being better health, better control of symptoms, better outcomes, but also better value and people being able to get back to work, people being able to contribute economically, as well as the economic growth that industry can bring. And that is not about dropping, I don't need to tell anyone in this room about dropping a device into everybody's hands and saying, go away and be healthy. This is going to need a deeply integrated approach that actually has the patient at the center, but we translate the device and the data that comes in from them into things that people can visualize, understand, and make sense of. We can't just create vast new pools of data flowing in to busy clinicians or to busy people's lives. They've got to be presented in ways that actually help develop insight and education, don't add to anxiety, but prompt useful action. It's when we get to the action planning and tracking that we start to actually create value if someone is doing something differently in their lives to stay healthier, or being able to maintain a medication regime, or being prompted to actually get in touch with a health and care professional. And the sustainability of this over time is something we're also very conscious of. So the individual has to see some sort of impact and reward from that. And that's when we start getting to these bigger goals. And we want to make sure that we're keeping that in mind as we think about our policy for developing wearables. In the time I have, I won't go through every challenge that there is to get this right. We know that this is a significant way to go from where we are today to that vision of having wearables being integrated into routine care by 2035. I might pick out a couple around ensuring that we are driven by what we call the use cases, by actually the problems that we are trying to solve for patients and the public, and then thinking about what is the right way to resolve that, rather than starting with what can the products do and working back to patients. The risks of siloed data, if everyone has their own device or if everyone has their own, and that data is held in one place or not integrated into other pools, we get partial pictures. We run risks of making mistakes we've made in the past. Pathway transformation, I've spoken about as in actually ensuring that these devices are part of clinical care, the right support and advice is around, professionals are supported in their use as well as patients and the public. And I was pleased to hear Will saying that this group is thinking about answering some of these research questions around actually what are the dynamics around health inequalities here. I think we realize it's a nuanced picture. There could be actually some huge gains here in people being able to participate in research or being able to participate in care in ways that fit much more around life, and there could be real gains. There are obviously huge risks as well that we may exacerbate inequalities if we don't do this thoughtfully. Margaret and Leila have done a great job in explaining the importance of public trust and clinical trust. We're working closely with our clinical colleagues to understand their concerns and the opportunities they see around the agenda. And then finally, I'll just pick out the evaluation, the importance of evaluation. We need far better research and understanding on the real-world impact of these technologies to help inform and guide policy, something else that this group will contribute to. So finally, I just want to reinforce that opening point that these technologies, we believe, can have a contribution to make across stages of care, from the lowest acuity settings to the highest, in keeping people healthy through to supporting people to be independent and stay better for longer at home. And then when hospital care is needed, being able to get people home, monitored and back to life as soon as is achievable. And then the point that I'm happy to hear, it seems like every speaker may make today, but that is the point, is that the success of this will require the collaboration of everyone in this room and beyond. There are things we can do nationally, but we recognise that the success or failure of this will be about bringing together all the stakeholders to try and achieve that joint goal for better prevention, more care at home, and better outcomes. A final note and plea: we have opened a survey in partnership with the British Heart Foundation, bearing in mind we have that first policy goal around remote monitoring and cardiovascular care by 2028. We are looking to understand the extent to which wearables and connected devices are already being used, the purposes for which they're being used, and people's views on the barriers and enablers to move from successful pilots, which we do have examples of, up into a national adoption, and that's open for another week. Contributions would be very welcome. So thank you very much for the opportunity to share this with you. Thank you for all the work that you're doing to try and turn this vision into reality.